Basically, this is a very good handheld tool for all the interventionals for the cardiac patients. This machine is useful for me in the pre-operative assessment of a patient also when I go for the rounds and deciding for the operability of the patient. So even bedside I can take a decisions whether I need to alter some medicine, cardiac medicines, that also can be taken decisions with this. Even in post-operative cases, beside the inotropes, vasodilators, volume status, cardiac re-explorations, there are tamponade and all. Even in the post-cardiac surgical patient into the ICU, it can reduce the requirements of the advanced hemodynamic tools like Swan-Ganz catheters eventually once you are very much accustomed with this. So even in all cardiac interventions, rather than even surgical, even in the cardiology, like after cardiac intervention, the bedside tool, it is good. The good thing about it is, along with this cardiac usage, it can be used as an abdominal scan as well as the gynec scan. So sometimes it can be utilized as a complete scan of the thoracic and abdominal problems. It can replace the advanced catheters, the stethoscopes, the treatment based on very blind monitoring devices that can really give a lot of inputs to our management. In general usage for all cardiac interventions, whether surgery or non-surgery, this can be a very useful tools eventually.
The V-scan which has been just shown to me is phenomenal, and I have feeling that this is the one which may replace a stethoscope in future.
I think this is a great device for us to carry on our ICCU rounds. The echo images are excellent, our diagnostic quality definite. Congratulate the GE for this invention.
It is an extremely important innovation because of ultra portability, because of its feasibility, because of non-invasive nature.
It's a very fascinating product. I mean, to a cardiologist, like a stethoscope, it can become a portable handheld device to diagnose, especially in emergency situations.
It can be taken to any part of a hospital, city, and is a very useful modality as far as echo is concerned.
I always thought that cardiac imaging was much more complex and it would not fit into a small handheld palm top type gadget. And certainly the 2D pictures are just as good as any handheld or portable carrying ultrasounds, and I think it will go a long way to make physicians' bedside rounds more meaningful and more objective. It's an advancement in the right direction. It is just not a gadget without a role and you're hunting for an application. I think the application is always there. I think the gadget has just come on time.
I think the predominant use will be in the OPD outpatient services, where the amount of time taken for a patient assessment will be brought to the minimum.
The first thing that impressed me was its compactness and low weight, so it's easy to carry around. And from cardiac point of view, if I have a patient with chest pain, I would immediately know what the heart is acting like, and I may be able to immediately decide whether this is a cardiac chest pain or non-cardiac chest pain. I think it's an excellent and a great idea, and it can be probably great use in clinical practice, especially in hospitals where they don't have all kinds of facilities. They can quickly decide whether the patient can be managed here or the patient can be discharged or has to be referred to a higher center. It's a unit which is useful for physician, obstetrician as well as cardiologist for a preliminary assessment.
Absolutely, it's the most important thing. I feel it is going to be very useful in emergency cases.
You are right, I have seen the demo of this machine. It seems to be very fantastic.
All in all, I think it will be a great stuff.
You can keep this, this is such a handy portable, put it around the neck and keep this in your pocket.